just gotta be fearless.
And the microphone, and I hope that looks like we're getting some audio now. So I wanted to go live because of recording a video, I don't see it on the Mac, I don't have the software, but I realized that I could AI dub in other languages, which was something that I wanted for Paradigm as it is in Hawaii and closer to Korea and Japan, and I want to offer this service of the stellate ganglion block for PTSD, trauma, autoimmune conditions, menopause, postmenopausal hot flashes, autoimmune diseases, fibromyalgia, shingles pain. There are so many applications for the stellate ganglion block, but once I realized that for about 10 cents, I can audio dub these over into Korean and Japanese, and it's doing a great job, that I wanted to go ahead and get that piece started. So going live was the easiest and best, fastest way to get the content and talk about stellate ganglion block for PTSD. Used in the United States military, veterans coming back from traumatic situations. Research shown that it is effective as oral medications that are commonly given with tons of side effects. The stellate ganglion block side effects are generally associated with a successful block and are temporary, between less than an hour. Those uh, increased secretions, stuffy nose, cough, hoarseness, changes in your pupil. That means you got a good block. Those are not really side effects, those are intended effects of the block. And that it's been used for PTSD and trauma and expanded use, shown by colleagues and peers of mine all over the country. If you're in Hawaii, coming to Hawaii, or looked into the stellate ganglion block for any reason, there are more than I've stated now, and I'll make another video series regarding all the uses. And I'd like to have folks come in with rheumatoid arthritis, have the stellate ganglion block, and find that, as patients in the past have, require less medications or stop taking their medications. So we're not advising anyone to stop or start medications, but there are effects that are seen with the stellate ganglion block that have tremendous effects on people's lives. The other issue in Japan that I've researched is that there are different methods of stimulating the stellate ganglion in the neck. Devices that I'm seeing advertised in the United States for stimulating the stellate ganglion and autonomic dysfunctions. I've even been postulating to expand this to Crohn's disease sufferers, because there is an element of autoimmune in that condition. So this video will be available obviously in its original form here in English, but you'll find it in my playlist of Korean and Japanese dubbed video series as I continue to talk about the application and availability for the stellate ganglion block in Honolulu, Waikiki, downtown, Hawaii. coming in September, will be opening and available for appointments, bookings, evaluations, and treatments. The stellate ganglion block is nearly self-scheduling, and when I'm available and you're available, we meet at the office. You come in, we can talk as much of you as you'd like. We'll talk about the risks and benefits. Prior to coming in, all the paperwork will be electronically signed. You lay down on the table. We'll put some cold gel on you, some cold spray on you after we clean up the site. We'll put the needle in and the ultrasound probe on your neck. We'll all watch the needle reach the area, target site near the nerve, inject the medication, and then you sit for 20 or 30 minutes. Whenever you're comfortable to leave, you're free to go. You'll experience a relief, a calm. Maybe you'll experience energy. A lot of these fibromyalgia patients say that they've never had this much energy for as long as they can remember, and they go out and do things that they've never been able to do in the past. This is the mystery and magic of the stellate ganglion block, anesthesia in general, lidocaine, local anesthetics. On my website, paradigminjections.com, under the blog section, you will find I will be uploading a book that I tracked down through various means and travels. Hand scanned, 75 pages, written in 1950s, regarding the stellate ganglion block and its uses then. And those things have developed, been left behind for the modern Western medicine and pharmaceutical industrial complex. It would be another long video to explain the nuances, odds and ends, and the differences between different countries. But as far as I can tell, it's being done in Korea. I read a paper case study of a woman who went under the protocol of having one every day or two. Sometimes folks like to do the left side in the morning, have the patient come back in the afternoon for the right side, calling that a dual sympathetic reset or a bilateral procedure, meaning both sides. We're going to focus on the right, and we're going to go on the right. If it doesn't work on the right, come back on the left. Kind of a one and done, and what I can compare this treatment to is I'll have to think about it more, but simple, easy, and quick, in less words, and you're on about your day. The changes may be dramatic, but as far as having a procedure done, or what you will be like afterwards, that is slightly unpredictable and based on many factors. But in other videos, if you have or haven't seen, and I should repeat similar messages in all the videos so you don't have to watch all the videos, but your body experiences a traumatic event, or your body goes through changes such in menopause, where now your chemistry changes, or the senses come in and those are encoded into your organs that are touched by the stellate ganglion nerves. And those stimulations are automatically, uncontrolled by your conscious, relayed back to your brain constantly, like a memory. And when we put the stellate ganglion block or the lidocaine medication near the nerve to numb that space, it calms your brain because the messages stop coming. Now, how you reset, some folks offer a protocol for education to meditate daily, cold plunge, etc., breathing. All of these things, anything you do in life changes you and sets you on a different path. And my goal with the stellate ganglion block for anyone is to get you out of a crisis and or over the edge to where you want to be. That little extra push. So I thank you for listening, and I hope this helps.